My big goal in treating any patient is to help alleviate the suffering, the symptoms, the condition that's getting in their way of them living their life and achieving their goals. I'm Dr. Richard Hempel. I'm the Vice Chair of Psychiatry here at Mainline Health. You should see a psychiatrist when you're feeling on an emotional level, on a functional level, you're not where you used to be. You're worried about something, you're not able to meet your life commitments. My clinical focus is basically a general psychiatrist. My specific interests have been more adult ADHD, major depressive disorder, generalized anxiety disorder, OCD, and treatment refractory or resistant depression. And what I mean by that is folks who have failed multiple meds or multiple types of treatment and are looking for other routes that are evidence-based, but still have smaller numbers of people needing them. ADHD is not just a disease of childhood, but it happens in adults too. Sometimes it carries on, sometimes it rears its head first then. The signs and symptoms of adult ADHD are complex, and sometimes they get missed for a long time, and trying to get at least an initial idea of whether there's a symptom burden there is useful, but there are a lot of different methods we use to get to the root cause of our patients' problems. The most important thing in care for patients is the diagnosis first, and that's a complicated ask. Getting to that involves getting to know the patient extremely well, not just doing checkbox psychiatry. We want to know people on an individual basis, on a value basis, and try to work from there to come up with a diagnosis that fits. And so, sometimes that means psychotherapy and talk therapy. Other times that means psychopharmacology and trying out different medications. So we take a lot of pieces of information and data and sort of integrate them together. That's where the experience comes in, the evidence base comes in. I have a lot of methods, a lot of strategies to try to help my patients heal and grow, depending on the problems that they identify and bring into the office. The interesting thing about psychiatric illness and mental health diagnoses and behavioral health diagnoses is that they respond well to a concerted effort of treating them. Sometimes it's not right out of the gate, there's no quick fix, but for a lot of people there are ways to improve things over time. It's a way to start to go after things that people thought were hopeless. I'm proud to be part of behavioral health here at Mainline Health, where we offer a lot of different wonderful services, top-of-the-line, evidence-based, cutting-edge services that help a lot of different people in our community. Where I get the satisfaction is helping people work through their challenges and their difficulties with the tools that I have that maybe they don't have access to elsewhere.